Cancer Corner, presented by Coosa Valley Regional Cancer Center, and Dr. Scarbrough with us again this morning. Doctor, good morning to you, sir.
Good morning.
Thanks for being with us this morning. And we'll talk today about cancer screening and kind of share a little bit about that and how it works.
Well, cancer screening means we're looking for cancer before signs or symptoms appear. The screening program in general is applied to an entire population of people, and that's the only way that screening works, much the way maybe vaccinations work. They only work if you get a large number of people involved in the process. So in terms of looking for cancer in people that we don't know have cancer, there are 5 major programs that are sort of scientifically recognized as being valid at this point in time, and that is colon cancer screening, breast cancer screening, prostate cancer screening, cervical cancer screening, and lung cancer screening. And I thought we could kind of mention all those today, go over them in a little bit of a stepwise fashion, see what the pitfalls, pros and cons of each of those are, and just talk about them.
What causes specialists or these examinations to begin looking for cancer in someone?
Well, I would say maybe the first cause is as you get older, if you're going to see your primary care physician or just your general physician on a year-to-year basis.
Why do you look at me when you say older?
Well, we're all getting older.
Yeah.
It's either that or die, so I'd rather choose getting older.
Yeah.
But yeah, as you get older, we have recommendations in place. You know, women, as years advance, we recommend different cervical cancer screenings or different breast cancer screenings. Men, once we get up to the age 50, 55, 60, we start recommending lung cancer screening if appropriate, or prostate cancer screening. So I'd say that'd be the first thing. That's the first thing we go looking for. Otherwise, you know, as I said, for a cancer screening program, we look for it in everyone. In other words, everyone that walks in through the door in a primary care physician's or OBGYN's office, they're going to, quote, look at that patient and think, we need to screen this patient for cancer. And hopefully the screening programs are effective. A lot of times they'll pick up things that aren't cancer. That's one of the drawbacks of a screening program. They will see things that aren't necessarily cancer, but then we have to do additional tests or studies to confirm those. For example, like with colon cancer, which may be the first thing that we should talk about today. We recommend people come in and get these tests, and you can see them on the screen. We'll pop those up very quickly. And the thing about colon cancer is, I've sort of shown here on the graph, the incidence of it has been going down over time, as has the death rate. And if you look at 50 years ago, 40 years ago, only 1 out of 2 people survived colon cancer, and nowadays at 5 years, and nowadays about 2 out of 3 people survive colon cancer after their diagnosis. That's because treatments are getting better, but hopefully because the screening is catching cancer at an earlier stage, which makes the cancer more treatable. That's another thing about cancer screening too. That's another theory behind cancer screening. If we can catch a cancer at an earlier stage before it's spread, it makes it more curable, it makes it more treatable, it makes it more survivable. So with colon cancer, we have various things, and again, we showed them there on the screen. We can do tests on the stool for blood or cancer cells themselves, or we can actually go inside with a camera and look inside every 5 to 10 years. And your primary care physician should be alerting you to the need of that, like I said, as you get older.
Now, there's some numbers and statistics there. 1 in 3, we don't get that screening done.
That's right. If you remember Katie Couric, her husband actually passed away from colon cancer. And for a while there, you know, she was really front and center on TV telling people, get a colonoscopy at the recommended intervals. And it's no fun, let me tell you, it is no fun to get a colonoscopy. You have to do a prep a day beforehand. You have to go in and get this minor procedure done. And no one wants to do that, but if it can potentially save your life, and we have sort of proven in science that it can pick up colon cancer early, why not do it?
What are some of the other screenings?
Well, we have cervical cancer screening, and if you look at that, of all the maybe screening programs that we do, cervical cancer is the rarest of all cancers that we screen for. If you go back 100 years ago, the leading cause of death in women was cervical cancer. Nowadays, it's actually a very rare cancer. If you think about breast cancers, nearly 250,000 women a year in the United States get diagnosed with breast cancer. Only about 12,000 women a year get diagnosed with cervical cancer, and also only about 4,000 deaths a year from cervical cancer. That is probably because our screening program is so good for cervical cancer now. We can catch precancerous lesions in women and treat those, and hopefully that prevents actual cancer from occurring. There is a little bit of an evolution taking place now in cervical cancer screening. If you go back many years ago, we recommended that people get a Pap test, which is where we basically just look at cells from the cervix under the microscope every year. Now the recommendation is every 3 years. And as you get older, we also add in looking for the HPV, the human papilloma virus, the HPV virus. We add in looking for that at specified intervals as well. It may be several years from now, we may actually move away from the Pap test and just only look for that HPV as the screening test.
When should females begin to do these screenings?
So the recommendation is to start around age 21 for the Pap test, and then, as you can see on the slide, as you get older, to then add in the HPV onto that. Once you get up to a certain age, we think that you can stop the screening after you've had multiple normal tests of the Pap and the HPV, or if you ever get a hysterectomy, and a lot of women get hysterectomies before age 65 and they've had normal tests, then we think you don't have to screen for cervical cancer then.
Dramatic drops in death by being screened.
And that's what I'm trying to show, that as we've added these screening programs in medicine, like I said last week, people ask, will we ever find a cure for cancer? Part of finding a cure for cancer is screening programs that will catch cancer earlier to make them more curable.
I guess the more common cancer that we hear of in women is breast cancer.
Oh yeah, absolutely. And like we mentioned again last week, we have the pink ribbons and the race for the cure, and we have, I want to say, almost every woman in America as they get older recognizes the need for a mammogram. I see a lot of breast cancer in my own practice, and I treat a lot of breast cancer. So obviously, if these women have had breast cancer, they've usually had a mammogram. So I'll see them, and they almost to a person say, I knew how important getting a mammogram was every year. Other women, occasionally I'll see a woman that will come in and is diagnosed with breast cancer and said, I skipped my mammogram for 2 or 3 or 4 years. And the cancer may be in a more advanced stage at that point in time. But that's actually kind of rare. If you go to different countries, Europe in particular, some countries in Europe, they are now recommending against the mammogram. There was an article in Time magazine back in December of 2017 that was sort of, let's say, as the kids say, throwing shade on the mammogram and saying, should we do that? Does it really lower death rates? It is a bit of a controversial subject right now. That said, again, if you look at that graph and you look at how the breast cancer survival has increased over time, the rate actually of breast cancer is going up, as you can see, but the death rate of breast cancer is going down. Now, some people are saying that's purely because our treatments are better. I do believe that mammograms catch breast cancer. I do believe that you should follow the recommendation of the American Cancer Society right now, which is to begin screening certainly by age 45 to 50. Your doctor can offer it to you at an earlier age depending on risk factors, and continue that. I just saw a woman this week who was 92 years old, diagnosed with breast cancer by mammogram, but her doctor insisted that she see me because she was so healthy. I mean, does not look age 92 at all, and is like taking care of 5 grandkids and out, shopping at the Publix and doing everything. So, again, some age recommendations are in there, but you have to sort of temper it also with what the patient looks like and the patient's wishes.
Dr. Todd Scarbrough, our guest this morning. Cancer Corner every Thursday morning here on Daybreak across the state of Alabama on Charter Cable. And, you mentioned last week, I think you've got 8 locations,
Yep.
8 centers?
Mm-hmm. We have 8 locations. Interestingly, in cancer centers like ours, and this is true in most cancer centers, we don't do screening for cancer at our cancer center. Mm-hmm. As I mentioned, the screening actually takes place out in the public health clinics, at the general practitioner's office, and then that's how eventually the cancer's found, they get to us. So we don't actually offer mammograms or colonoscopies or anything like that. Interestingly enough, I'm actually trying to implement a lung cancer screening program, and maybe that'll be a natural segue to that at some of our clinics. Because of all the cancer recommendations for screening, this is the newest one. We began studying this actually late in the 20th century. The first reports about doing lung cancer screening came out in the early 2000s. And of all cancers that exist, lung cancer is the most deadly. It's not the most common, but it is the most deadly. It's not the most commonly diagnosed, but it is the one that most commonly kills people. So a cancer screening program was wanted and desired by cancer physicians for many years. We couldn't come up with a good blood test. We actually tried a screening program. We would have people, spit, and we would try and look for the cancer cells in their spit. None of that worked out. We looked at just doing x-rays on people, just a lung x-ray. That didn't work out. But doing a CAT scan, which again, of all the screening programs, is probably the fanciest screening that we do for any cancer test, and maybe probably the most expensive. We actually are now recommending for people that are a smoker or they were a former smoker, and you can see the particulars there on the screen. If you've smoked for 30-pack years, which means if you smoke for 15 years, 2 packs a day, that's 30-pack years. If you smoke for 30 years, 1 pack a day, that's 30-pack years. And you've had 30-pack years of smoking, we recommend getting a CT scan of your chest, a low-dose CT scan of your chest every year. We think that that lowers the death rate by about 20%. It's been now validated in what we call randomized trials, which are the best test we can do in medicine. And as you can see, the death rate from lung cancer has gone down. Now, in terms of, if you go back, again, 50 years, 11% of all people survived at 5 years after being diagnosed with breast cancer. Now that rate is up closer to 20%. In actual numbers, absolute percent, that is not a big jump, but in relative numbers, that's an almost 100% improvement in survival over the last 50 years in lung cancer. Now that has almost certainly been purely from the treatments getting better. Hopefully it will improve even more as we're catching more lung cancer earlier. And we have great treatments for lung cancer now. Early stage lung cancer, we can treat in 4 days with radiation, with no side effects, and without a scalpel, and no downtime, and have cure rates that approach that of surgery, going in and getting part of your lung cut out.
Wow. Now, you got a video clip about this this
Yeah,
morning.
I thought this was interesting because, this recommendation has just come out recently. I haven't actually seen this commercial on TV, but it's out there in some markets. We could go ahead and play it now.
Let's take a look at that.
Yeah.
Eva Marie smoked 12,000 packs of cigarettes over 15 years. She quit, and now there's a new lung cancer screening that could save her life. You stopped smoking, now start screening. No matter how much you smoked, early detection could save you. Talk to your doctor or learn more at savedbythescan.org.
Wow.
Yeah, this a visual sometimes is worth 1,000 words,
Goodness. Dr. Todd Scarbrough, our guest this morning. We're talking about cancer screening on this segment of the broadcast, and there are other treatments, other screenings that we do as well. Is this more prevalent in men or women? I know there's different types of cancers that affect different individuals?
Absolutely. So, a cancer screening that is directed purely at men is the prostate cancer screening. Obviously, cervical and breast cancer is directed purely at women. Interestingly, men can get breast cancer. We never talk about that, but 1 out of 100 cases are male breast cancers of all breast cancers. We can talk about that another day. But as far as cancer screening directed purely at men is prostate cancer.
We don't want to talk about prostate cancer. I mean,
no,
guys
nobody wants to talk about prostate cancer. As a field of cancer medicine, the prostate cancer screening is very controversial. If you go back 30 years ago when the PSA test first came out, it was being used widely overnight. And you can see on the screen that spike in prostate cancer incidence. It's not all of a sudden that prostate cancer started afflicting the population in an unknown fashion. It was that we began widespread screening of the population for prostate cancer. So that spiked, and also if you look at the survival 50 years ago, 66% at 5 years. Now look at the survival nowadays for prostate cancer at 5 years, 98, 99%. Why is that? Is it that the treatments have gotten better? I think it would be difficult to say it's purely because the treatments have gotten better. I think it's because we have caught prostate cancer at much earlier stages, which makes it more treatable. 2 or 3 years ago, the U.S. Preventive Services Task Force removed its recommendation to get routine PSA screening. Their argument is that you have to test it in 500 to 600 men to save one life, which may be true to some extent. However, as we have tested this now in randomized trials, they have revised that recommendation, and it is now the current thought that we should go back to at least offering PSA testing to most men, mentioning it, going over the pros and cons, and helping men get a diagnosis of prostate cancer earlier if they have prostate cancer. When should that start? It should start, as mentioned in the screening, around age 50 is the current recommendation. Different societies will recommend different things. If you look at, we were showing one slide there, in the UK, England, they are recommending now no PSA testing. That started in 2015. So they have removed widespread screening for PSA testing and prostate cancer testing. Now, 2 or 3 years later, the incidence of prostate cancer death rate is surpassed that of breast cancer in the UK. I think they will go back to PSA screening in the UK with this new evidence and maybe that trend.
Symptoms of prostate cancer?
Urinary problems, blood in your urine, pain in your pelvis are usually the first symptoms. It is usually a slow-growing cancer. You have to have the cancer in place for a long period of time to get pain. Sometimes men present with prostate cancer that's already spread. Usually it spreads to the bones if it's going to spread anywhere. So sometimes a backache or a pain in your shoulder, a pain in your arm in an old man sometimes is prostate cancer that's spread to that region. It's variable from person to person. Hopefully the first sign of prostate cancer is an elevated PSA blood test.
Early diagnosis is key.
That is early diagnosis.
Yeah. Dr. Todd Scarbrough, our guest this morning, and we're talking about cancer screenings. And I guess this begins with your local physician?
Absolutely. Everyone should be seeing a physician routinely. That was something that we were saying back during the healthcare debate. People should go and be taking care of themselves, and I believe in general people are taking better care of themselves nowadays. It's important for general practitioners to know what the current screening recommendations are, because you wouldn't just, even if you're the world's smartest doctor, just wake up one morning and say, I'm going to start doing a CT scan of the chest on every smoker that comes into my clinic. You would need a test, you would need a large study from multiple centers with people followed over years and years to even start making recommendations like that. And then once that knowledge gets out there, you have to stay up to date as a physician and read and recognize what are the recommended studies, because even though these are not cancer physicians who are recommending cancer screening, that's kind of a little bit of a disconnect. But these societies like the American Academy of Internal Medicine, the American Family Physician Society, they get that knowledge out there, I think, pretty reliably and regularly to their physicians to let them know about what are the recommended cancer screening programs that are out there. Women at a young age, they aren't going to see necessarily a doctor for any reason except to get pap smears. And I think women, young women are good about doing that on the whole.
With general physicians, our family physicians, you know, they see, I mean, the clinics and stuff are jam-packed with people every day.
Yeah.
How important is it to us as a patient to maybe say, hey, can you do this test? Can you recommend this?
Hopefully, you don't have to do that as a patient. You know, hopefully you don't have to do that. On the other hand, let's say, you know, the American Cancer Society says, recommend talking about it for an age 40-year-old woman. Now, if a woman comes in and she just completely doesn't tell her physician about anything going on in her life or her family history, he may not recommend that because he wouldn't think to do it. But if she comes in and says, you know what, my sister has had breast cancer, my aunt has had breast cancer, my mother had breast cancer, as did my grandmother, and they all died from breast cancer, and she's 35 years old, that family physician or primary care physician needs to sort of put two and two together and say, I may need to get this patient to screening early and do a mammogram. Or in the case of Angelina Jolie, for example, who had and was very open about getting a bilateral mastectomy, she had actually a genetic abnormality that made it more likely for her to get breast cancer or ovarian cancer. So she had that prophylactically. That's not necessarily part of the screening discussion, but be that as it may, sometimes you have to mention things. Hopefully you don't have to mention things, but tell your doctor everything about your history. Tell your doctor everything that's going on with you. And if they're a good doctor, they'll get you to the right screening test.
Dr. Todd Scarbrough, our guest this morning. 8 centers here in Alabama. You work out of the Anniston?
We're in Anniston. I'm in Anniston and Fort Payne. Here in Sylacauga, I'll be here in Sylacauga in April, as a matter of fact. I like to stay a little bit closer to home, but we rotate everywhere. And as I mentioned, if we can get our lung cancer screening program up and running, I may be doing that in more of our clinics throughout Alabama.
All right, sounds good. Dr. Todd Scarbrough, our guest this morning. This is Cancer Corner every Thursday morning about 7 a.m. And Dr. Scarbrough is with us. And in future programs, we're going to be taking your phone calls with questions you may have a different topic every week. Today, what is cancer screening and how do you get it done? And there's a lot of information. And the good news is, with these cancer screenings, we've made great inroads in the treatment and prevention of cancer.
I feel so. I think so. The first time I really sort of officially stepped foot into a hospital was the first year of medical school, which for me was 1994. That was a long time ago. And things were noticeably different back then. I remember a physician of mine who was a mentor, who was an older fellow at the time, saw a patient with prostate cancer, and he said when he was younger, one of his physicians showed him a prostate cancer patient that was very advanced and said, look at this patient, this will be the only one you see in your career. Now prostate cancer is very common because the screening is out there and we're looking for it.
Hey, thanks for being with us this morning. Dr. Todd Scarbrough, our guest this morning on Cancer Corner.